Hello, everybody. Thank you for making time to attend our webinar. Today's webinar will focus on autoimmune disorders. When diagnosed with an autoimmune condition, most are told there is no cure. However, identifying root causes and underlying triggers can help to minimize symptoms and in some cases reverse autoimmunity. This webinar will cover factors that are associated with increased susceptibility and therapeutic interventions. For individuals who are willing and motivated to improve their health, many can overcome the signs and symptoms of autoimmunity leading to improved lifelong health. I would like to begin by introducing Dr. Furness. Denise Furness is a functional geneticist and nutritionist. She's a pioneer in the field of nutrigenomics and personalized health with over 15 years experience in the area. She began her career as a research scientist, focusing on folate metabolism and epigenetics in relation to pregnancy health. Over the years, her research expanded, covering vitamin D, immune markers, and oxidative stress. She has published her work in peer-reviewed journals and has won numerous awards for her research and conference presentations. In 2012, she founded Your Genes and Nutrition and began applying her knowledge in private practice. Denise has a special interest in women's health, fertility, and autoimmune disease. Furthermore, Denise provides workshops and seminars for health practitioners, drawing on her clinical trials, the latest evidence-based research, as well as her personal experience with autoimmune disease. Please, as a note, put all of the questions that you have throughout the webinar in the chat box below. We will conclude today's webinar with a live question and answer session with Dr. Furness. And without further ado, I will turn it over to Dr. Furness.
Welcome, everyone. So hopefully you can see my screen now and hear me. If there are any issues, let me know. Otherwise, we are good to go. Before I start this, I would just like to inform you that I'm a paid medical advisor for Pure Encapsulations, and I have no other conflicts of interest to disclose. In tonight's webinar, we're going to talk about the immune system, obviously, with autoimmune disease. So I'll give you a brief overview of the immune system. I'm also going to talk about factors that increase susceptibility to autoimmune disease and disorders, and how to help your patients identify triggers and root causes. We'll then go through suggested lifestyle, nutrient, and herbal therapies to support immune health. So first, let's start with the immune system. The immune system is made up of our skin, which acts as a physical barrier, our gut, and we know that a lot of the immune system is actually housed within our gut. Our mucosal membranes are so important. We need those to catch those pathogens, bacteria and virus, and hopefully viruses, and get them out of the body before they can infect us. And we also have our lymphatic system, which is important to flush out toxins as well as pathogens. And then getting a little deeper, looking at the lymphatic system as well as organs that are required to make immune cells. We've got the spleen, the bone marrow, the thymus, as well as our white blood cells. And these are the immune cells that are required to go in and fight these infections. We also have antibodies and the complement system, as well as cytokines. I'll talk more about those when we talk about inflammation. And it's all of these things together. All of these things need to be functioning properly for our immune system to work properly. So what is the purpose of our immune system? Really, I think we all know it's there to protect us from pathogens like bacteria and viruses, also to help us heal and protect us from injuries and trauma, as well as chemicals and radiation. So when the immune system is working properly, this is what it's doing. It's actually a defense system, but we know that our immune system can also be triggered by things like stress, and in the case of when we have a dysregulated immune system, our immune system can start to react to things like the foods we eat, as well as other things, our environment, and even start to attack our own tissues in the case of autoimmune disease. So what is inflammation? Inflammation is really the collective response of our cellular defenses, so those immune cells and chemical mediators. And when I say chemical mediators, I'm talking about things like cytokines, eicosanoids, as well as histamines. And we know that these chemical mediators can be overexpressed or even misdirected, causing chronic inflammation, harmful effects, and ultimately leading to autoimmune disease and chronic inflammation. So let's just differentiate between acute and chronic inflammation. Acute is what we want to happen, right? That is when you have had a cut on your finger, or you are exposed to a virus, or perhaps you've even been exercising and you've done a bit of damage to your muscles. You've trained hard and you've got some tearing in your muscle tissue. So in the acute state, it's localized. You would just have that inflammation around the muscle or in the finger if you've got a cut on your finger. The inflammation is rapid, it comes on quickly, and it doesn't last for long, perhaps a few hours, perhaps a few days. And what we have are vascular changes. So we see vasodilation. So these blood vessels are literally dilating and getting bigger, and this is because we've got increased permeability. So all those white blood cells and immune cells can actually get into the blood and heal that tissue and protect us from that pathogen or bacteria or foreign object. And in addition to that, we get the transport of these leukocytes or the white blood cells to that area of injury or infection. So that's acute. So that's acute, where the immune system says, hey, something has happened, I'm coming in, I'm going to protect you, and then I'm going to help your tissues heal, and then it goes away, it's done. But what we know in this day and age is so many people suffer from chronic inflammation. And this generally occurs when the inflammatory response is unsuccessful. So chronic inflammation is slow, it's long-term, and it can last for months and in some cases years. And when we're talking about autoimmune disease, generally these people have chronic inflammation for years. And what happens is, all at the same time, we've got tissue destruction. So the immune system thinks it's attacking a bacteria or a virus, or it's trying to protect you, but what it's actually doing is destroying your own tissues, and it's attempting to repair all at the same time. So you've got this continuous destruction, repair, and it's not actually going away. You're not having that acute inflammation that comes and goes. You've got this long-lasting inflammation, and that can cause chronic pain, chronic swelling, and as I've said multiple times, damage to tissues. And we often see this with people who have parasites, so gut infections, also those who are exposed to mold or fungi and have those mycotoxins, also people that actually get stealth infections, so bacteria, viral infections, or even mycoplasma. And these are linked with autoimmune disorders. So to be clear, when we have acute inflammation, this is a good thing, and there are beneficial effects. So we've got the dilution of toxins. So if there is a bacteria that's putting toxins into the body, by having this sort of infiltration of fluids and liquids and vasodilation, that can actually help dilute the toxins. We get entry of antibodies into the tissue to attack whatever that foreign body may be. We get fibrin formation so that our tissues can heal. And we also get the delivery of nutrients and oxygen as more blood is transported to that area. And basically that is all involved with this sort of stimulation of the immune response. But when the immune system is dysregulated, and here we're really talking about the chronic inflammation, what we have is persistent cytokine release. So these cytokines are these chemical messengers that are involved in triggering the immune system. So they're constantly being released, constantly triggering the immune system. And we're getting the destruction of normal tissues. So for example, in the case of, say, Hashimoto's, there's destruction of the thyroid tissue. We also get swelling, and this is really an inappropriate inflammatory response. And what I don't have there, but I should have, is also pain. We also see that a lot of these patients will have pain at the site of that chronic inflammation, or sometimes just unusual pains throughout the body. I think many of you have probably seen this before and you're aware of this, but just to make it clear, you know, the symptoms associated with inflammation are heat, redness, swelling, pain, and in the case of autoimmune disease, when we have that chronic inflammation, we can get loss of function. So again, if I'm just talking about Hashimoto's, so what you can have is, you know, the immune system attacking the thyroid. We then get sort of loss of function of that thyroid. The person is not producing enough thyroid hormones, and that can ultimately make them feel sluggish. Their metabolism slows down, they put on weight, they're tired, they've got brain fog. And this is really with all autoimmune diseases. It just really depends where it manifests in the body. With rheumatoid arthritis, we're thinking about the joints. We get this inflammation in the joints. And again, when we're thinking about loss of function, people start to get deformed joints and also lose the ability to move their joints properly. Let's move on to the factors that increase the risk for autoimmune disorders. So firstly, genetics plays a part. So in my case, it was mentioned at the beginning, I've had Graves' disease, and actually my father had Graves and his auntie, and I believe it was his grandmother. So from my father's side, I definitely inherited risk for Graves' disease and unfortunately have had it. So generally, if you look at your family history, if you haven't had your genetics done, you can find out what, or if any, autoimmune diseases you may be at risk of getting. In addition, if you're deficient in certain nutrients, if you are not giving your body what it needs to heal, recover, to work properly, that can increase the risk for chronic inflammation and autoimmune disease. And I've also got their dehydration. I think some people just forget to drink enough water, and I put this in here because it's an essential nutrient. It's not really a nutrient, but it's essential, and I think people often forget it. And I have to say, as someone who's had an autoimmune disease, very serious autoimmune disease, I was very, very sick, and then had a relapse after my second child, I know personally that my symptoms are by far the worst if they are sort of coming back. I sort of have to check in with myself when I'm not drinking enough water, and it can happen so easily. We are a culture of drinking coffee, you know, coffee in the morning, perhaps another one in the day, forgetting to drink water, and then many people too might have a wine or a beer at night and really just not getting enough water. And just remember that things like coffee and alcohol actually dehydrate you. So they're not so good. Disturbed sleep is a huge factor. I could actually just do a whole talk on just these risk factors. But yeah, sleep is definitely an underlying issue in everyone I've worked with. All the patients I've worked with who have an autoimmune disease or a chronic condition have problems with their sleep. Also, exposures to toxins and chemicals, so environmental pollutants. We need to be cautious, particularly women, of the amount of things we're putting on our skin and our hair. A lot of these are xenobiotics or xenoestrogens that can impact our hormone levels and then also influence our immune system. Those that have gut issues, if your patients are experiencing or have experienced, so many people have, a lot of my patients have for years and years, experiencing bloating or gut pain or sensitivities, that is a risk factor for autoimmune disease, as well as liver issues, of course, infections, which can trigger the immune system. Chronic stress is also a huge problem. And exercise. So interestingly, we do talk a lot about lack of exercise and people not exercising enough. But I have to say the type of patients that I work with often are the ones who are pushing themselves very hard, overachievers in their career, and just want, you know, the most out of life, and often are actually overtraining. And we know that if someone is exercising too much, that actually suppresses the immune system, putting them at risk of infections. They'd be more susceptible to, you know, things like mold and things like that, which can also lead to autoimmune disease. So moving on to the next slide, this is not specifically about autoimmune disease, but it's such a great representation of all of the factors that can cause chronic inflammation and then what that chronic inflammation can lead to. And this is a good one to show your patients to help explain that. So what we can see in the middle, if you look at that SCI, I'm not sure if you can see my mouse there. SCI is standing for systemic chronic inflammation. So as I just said in the previous slide, there are a number of things that increase risk for autoimmune disease, and this slide really highlights that too. So we can see chronic infections. This could be a virus, a bacteria, a tick infection, physical inactivity, obesity, dysbiosis. I said at the start that we house a lot of our immune system in our gut, and so many people do have gut infections or dysbiosis, and we know that the microbiome is so important for supporting our immune system and reducing risk of autoimmune disease. Diet is essential to ensure that we're getting enough nutrients, and so many people have a poor diet. Chronic stress and also isolation. This is a really important point to make right now with COVID and so many people having to stay home. This can actually cause to trigger the immune system as well, disturb sleep and exposures to chemicals and toxins. Ultimately, and it's not just usually one, it's generally multiple things, all of these things together. It may not be all of them, but generally there's a few factors together that really do increase the risk for this chronic inflammation, and ultimately that can lead to a number of different diseases. So in this talk, we're really focusing on autoimmune disease, but I'd also like to point out that inflammation is an underlying driver of many other diseases, including cancer, depression, even things like Alzheimer's and dementia. And actually, some people refer to Alzheimer's and dementia as an autoimmune disease. So let's talk about the causes and the diagnosis. So from that last slide, hopefully it's very clear, and I'm sure most of you know as practitioners that the causes are multifactorial. It's not usually one. It's genetics, it's lifestyle, it's the constant stress that patient might be going through, the lack of sleep. Are they over-exercising and not eating enough? They're just nutrient deprived, or they're not exercising and they're having a poor diet and they're overweight. We know that obese people, actually the adipose tissue, the fat tissue, does produce a lot of inflammatory cytokines. So these people are definitely at risk for having much higher levels of inflammation in the body. We know that for most patients, diagnosis takes a really long time because people present with all these unusual symptoms. And actually, it takes years to develop an autoimmune disease. It doesn't happen overnight. So people are generally pushing themselves too hard, or they're exposed to certain chemicals or toxins. They're not taking care of themselves, and they might have a few underlying symptoms. Their body might be trying to tell them there's something wrong, but they're not exactly sure what it is. They either ignore it or they do go to their doctor, but the doctor doesn't actually know what it is. So because diagnosis can take a long time, symptoms often get much worse. And then when patients are diagnosed, finally diagnosed with an autoimmune disease, they often don't know why they have developed these symptoms, and they're generally not given an explanation. I'm not sure how many of you listening have an autoimmune disease, and when you were diagnosed, if you were given an explanation. Sometimes the doctor, for example, if you do have a thyroid disorder, they might explain a little bit about the thyroid, but generally people aren't told why. And I know that one of the first things I wanted to know was, well, how did I develop Graves' disease? How did this happen? And I was thinking, this can't be happening to me. I eat well, I exercise all the time. And initially I was really surprised. But in reality, when you work backwards and start to look at all of these underlying triggers, it actually became quite clear to me that it was highly likely that I was on the way to developing an autoimmune disease. One, I had the genetics, the genetic predisposition. I was working in a pretty stressful job, running large research studies, also on the side working in the fitness industry. I was burning the candle at both ends. I loved to socialize on the weekends before I had children. Wasn't sleeping enough, probably wasn't eating enough for the amount of exercise I was doing. I then found out I was vitamin D deficient. That's actually because I surprisingly fell pregnant and was tested for vitamin D deficiency. But I was so sick I almost lost that pregnancy. So I definitely wasn't well, and there were a number of things leading up to it, but I'd ignored a lot of those signs and symptoms. So identifying these triggers and root causes is really important to help our patients understand the why, and I think this is an essential part in the healing process. And one of the tools that you can use to help your patients map out what has led to their autoimmune disease is a timeline. Now, you don't have to use this particular example here. I know that many of the practitioners over in the Philippines have done functional medicine, the IFM training. For those in Hong Kong, I'm not sure, but you don't need to use this particular template. You could easily draw out your own timeline. What's important to note is that you want to look at things that even happened before birth. Perhaps the mother was exposed to certain chemicals or toxins, or there was a very stressful event. We know that that can trigger epigenetic changes. You also need to think about your inherited susceptibilities. So what genes have you inherited from your mum or your dad that are going to put you more at risk? And really what you're then doing is looking at what autoimmune diseases have they had or your grandparents had. Then when we look at birth, you want to be thinking about things like, was it a cesarean section? Was it a vaginal birth? Were they getting exposed to all of those bacteria? Did the mother breastfeed? And again, if we're thinking about breastfeeding, that's introducing all of that good bacteria to help seed the gut, so helping with the microbiome that is so important for our immune system. And then you can start to sort of map out from there what happened in childhood. Did they get a number of recurrent infections? Were they on lots of antibiotics? Were there other stresses in their lives? And by putting all of this together, it can actually help your patient start to understand the why, and then they can start moving forward. So in addition to collecting all of this information, so finding out about the patient's history, putting all those pieces of the puzzle together, there's also a lot of testing that can be done. So personally, as a geneticist, I obviously do a lot of genetic testing, but you don't have to. In my case, most of the patients that come to see me do want genetic testing to look at these underlying genetic predispositions. But there's plenty of other testing you can do. So for example, nutrient levels is really important. A lot of the nutrients we're going to talk about today, you want to find out what are their vitamin A levels, vitamin D, just protein, looking at macronutrients. Protein is so important for the body to heal, recover, repair. Are they getting enough protein? Are they getting enough fat? And if you can't do a lot of blood testing, food diaries are free. You can get them to write out what they're eating, and you can get so much information of just collecting a food diary from your patient. Also, you can look at biochemical markers, specifically immune markers like CRP, looking at a full blood count and looking at the count of those white blood cells. You can look for gut infections and dysbiosis by doing stool analysis. Look for direct infections, as well as measure the level of environmental pollutants and toxins. So there is so much testing you can do. It really comes down to your patient's budget and what you think is the priority and what might actually help you treat your patient. So let's move on to therapeutics and what we can do to try to help these people get well. So from a lifestyle perspective, I mentioned how important dehydration is in increasing inflammation and risk of disease. So monitor water intake. It may be that your patients need to write it down. They need to carry a water bottle with them. Give them strategies to help make that really easy, because it is something very simple that everyone can do. And what I also should mention here is how important it is to be drinking clean water. So filtered water that is actually going to be helping hydrate your patients, helping them get rid of and flush chemicals and toxins out of the body, You don't want to be giving them water that is full of chemicals and contaminants, because that would make the body have to work harder. We want to be helping it clear these things. We want to focus on a low stress diet. So personally, I don't recommend a particular diet, whether that be paleo, keto, or vegan. I talk to my patients about a low stress diet. So removing these inflammatory foods. So number one, definitely sugar. You may want to consider, in some cases, not all, but a lot of people respond well to getting off gluten. They may not have to get off it forever. From a genetic standpoint, some people are likely to be more sensitive to gluten if they have particular HLA genotypes. So thinking about gluten, thinking about dairy, which can be quite inflammatory. The other thing is too, by keeping a good food diary, if your patient doesn't know what their triggers are, you can actually keep a food symptom diary, and they can start to write down when they're experiencing certain symptoms to help them identify if particular foods are actually triggering gut symptoms or pain or some other sort of inflammatory symptoms. Set up good sleep habits. This is so important. Without proper sleep, the body can't repair and heal. Reduce chemical exposures, so educate our patients about all the chemicals that are in the environment, in the products they're using, that it could possibly be sprayed on their food. And also helping them with stress management, providing them with tools, or in some cases you may want to refer out. And moving their body. Exercise is so important, but as I said, not overdoing it. So let's talk about the foundational immune support. So when I think about supporting the immune system, straight away I think about vitamins A, C, D, and zinc. There are many other things, and we'll talk about those too, but when we're thinking about the immune system, these are particular nutrients that have so much evidence that we know are absolutely essential for our immune system to work properly. You can have a look at this paper in your own time if you want to, but this is from Nature Reviews, so Nature obviously being a top journal. And if you just look at this little bottom bit here, the final few lines in the abstract, we can see that it says, talks about the clinical potential of vitamin A and vitamin D for modulating our immune responses and preventing or treating inflammation and autoimmunity. So I don't want you to think that all you need is, vitamin A and vitamin D to treat your autoimmune disease. It's not that simple, but just know that if you are deficient in these, it's definitely going to increase your risk of autoimmune disease. And then by having these, you can actually reduce inflammation in the body and potentially help reduce those symptoms. It's definitely something that's helped me and helps my patients. And then just to give you a little bit of insight into, this is from that same paper. It's actually a fantastic paper. If you're interested in vitamin A and vitamin D impacting the immune system, I definitely suggest having a look at this review. This is just one of the images from it. And what we can see here, if we're looking at figure A on the left, we know that vitamin D comes from the sun. It has to be converted into the skin to pre-vitamin D, which then goes to our vitamin D3. And if you're getting it from the diet, though there's not much vitamin D in food, or if you are getting vitamin D from supplements, which is very common, that comes in the form of vitamin D3. That then needs to be converted to the 25-hydroxy. So those of you who get your vitamin D levels measured, that's the 25-hydroxy. And then that's converted to the active form of vitamin D. So that's the 1,25-hydroxy D. So vitamin D is more like a hormone. It actually regulates lots of things in the body, and it actually turns on hundreds of genes involved in supporting the immune system. And what you can see here with the vitamin D section here on the left is we've got vitamin D actually entering those immune cells. So here we've got a macrophage as well as a T or a B cell. Vitamin D is getting into the cell and then actually switching on genes within that cell. And we can see here we've got the VDR, that's the vitamin D receptor. So vitamin D, that 125D binds to the vitamin D receptor. And that RXR is the retinoid X receptor. So vitamin A is also important. So we can see that vitamin D directly impacts our immune cells and helps support the immune system. So no wonder it's so important in reducing risk of autoimmune disease or helping us recover from that. If we look on the right here, we can see vitamin A. So if I sort of start up here where it says diet, so I'm looking at B over on the right. So we know that vitamin A can either come in the preformed vitamin A, so that comes from animal products and butter. It's a fat-soluble vitamin like vitamin D. So we have then retinol, or we can get vitamin A from beta carotene. So that's coming from things like carrots and vegetables and things like that. So here we've got our vitamin A either coming in as beta carotene or that preformed, the retinol. And I just want to mention from a genetics perspective, if anyone else out there does genetics, it's BCMO1, beta carotene monooxygenase 1, that needs to convert beta carotene into retinol, and we need to get the vitamin A converted into these active forms for it to work. And some of us have got genetic variations that mean we don't convert our beta carotene well into that retinol, and these people are going to need more vitamin A from the diet. And when I say more vitamin A, I mean that preform. So thinking about the butter, the animal products, not getting it from vegetable form. So these people that have these SNPs or genetic variations, if they were vegetarian or vegan, would definitely need to be supplementing with vitamin A in that retinol or retinol form. And I didn't mention it with the vitamin D. I mean, this talk's not about genetics, but from a genetic standpoint too, some people actually need a lot more vitamin D because they don't convert it as well from the sun. So there's a number of genes and enzymes involved in this pathway, and some of us have got different genetic variations depending on what we inherit from our parents, and we may need to get more vitamin D. So again, just going back to the vitamin A, we can see here in this particular example, we're looking at gut-associated immune cells. We know that vitamin A is important not just for the mucosal membranes, but also for actually supporting gut health and secretory IgA, which is that sort of primary, that first line immune defense in the gut, protecting us from infections in the gut. Down here again, if you're looking at vitamin A, like vitamin D, can switch on a host of genes that can support the immune system. So here we've got vitamin A binding with that vitamin A related receptor, turning on genes and helping us fight infections and support the immune system. So two key nutrients, vitamin A and vitamin D. So I've mentioned a lot of this. Vitamin A is important for our immune system. You can look at the details there. It's very important for the maintenance and integrity of our mucosal membranes. So important too when we're thinking about respiratory infections. It's our immune's first line of defense against minor infections of the respiratory tract, but also important for supporting gut health. We have the preformed, which is the retinol and the retinol esters, and then there's the provitamin A. So that's the beta carotene that I was just mentioning. That's what you get from your vegetable sources. So think about carrots, oranges, reds, and yellow vegetables have got these carotenoids in them that can act as a provitamin A. They just need to be converted into that active form in the body. Some of us do it well, some of us do not. So with vitamin A, I actually like to do lots of testing, but in this case, it's difficult to test because there's so many different forms of vitamin A in the body. I've just mentioned a few. We're thinking about different forms of carotenoids, the beta carotene, there's other carotenoids, retinol esters. It's difficult to actually measure vitamin A levels. So what I do is actually talk to my patients about their symptoms. You can actually find out from someone's symptoms if they're likely to be low or deficient in vitamin A. So firstly, night blindness. If your patient or even you, perhaps it's definitely happened to me, it's how I worked out that I was low in vitamin A. If at night, when it's just starting to get dark, you're struggling to see, that is associated with low vitamin A. Also, if you're starting to get some skin issues, perhaps you're getting, eczema or dermatitis, even acne, all of these things are linked with vitamin A. Or if you're getting chronic respiratory infections, remember it's important for those mucosal membranes. So you can ask your patients a lot of questions and actually find out, play detective and see if you think they're low in vitamin A. So with vitamin A, if you want to supplement or you need to supplement your patient, standard doses are around 1,500 to 3,000 IU per day, and the upper limit is about 10,000 IU per day. So if you were thinking more about an acute infection, particularly in this current climate, people are worried about sort of viral infections, you may be thinking about 10,000 IU for a short amount of time. You wouldn't want to do this for a long period. But if you want your patient to be on vitamin A for, for months and months, then you'd be thinking about more of these standard doses. Just remember, vitamin A can build up in the body. It is fat soluble, and consider where your patients are at. As we always do, we need to decide if this is the right thing for our patient. So we know that for pregnant women, for example, we don't want them to have too much vitamin A because that is linked with developmental defects. So vitamin D, I think we all know the importance of vitamin D. It's not just the immune system, it's also brain health and so many things in the body. But from an autoimmune perspective, we really want to be ensuring that our patients have adequate vitamin D and looking at levels above 100 nanomoles. So vitamin D is one of those things I do like to do testing for. And there is a particular paper here. You can check out the reference. It's a great systematic review suggesting that actually for optimal immune function, patients may even need to be up to 120 nanomole per litre of vitamin D. So this is really important to look at. The other thing is, if you don't have access to a lot of testing, again, you can ask questions. Is your patient going outside? If they're working indoors all the time and they're in the car, they're inside, they're not out in the sun, then it's highly likely that they are going to be low in vitamin D. Excuse me. A standard dose is 1,000 IU a day, around 1,000 IU a day. And the upper limit is 4,000 IU a day, though I'm pretty comfortable giving my patients 5,000 IU a day, depending on their levels. If they're low and I need to get them up. And as I said, their immune support may require high doses if someone has suboptimal levels. So you need to consider what's right for your patient, depending on their levels, or again, getting a very thorough history. So vitamin C is so important for the immune system. We have been hearing a lot about vitamin C over the last few months. It's probably the same over there in Asia. We know that vitamin C acts as an antioxidant, but it also supports the immune system. It may reduce the severity and the duration of the common cold. So the Cochrane review has stated that. We also know for people that are under high stress, people that are over-exercising, they've done some studies in marathon runners that vitamin C can actually offer more benefit in protecting against infections and colds and flu. So for anyone who is under high stress, definitely think about extra vitamin C. And again, when we're looking at the doses, it's about 1,000 milligrams a day is a standard dose. The upper limit is said to be 2,000 milligrams a day. Now that's for the USA, but I have to say here in Australia, we don't have an upper limit. It's hard to put an upper limit on. I'm not sure what it is over in Asia, but just know that these are very conservative upper limits, and the Mayo Clinic actually reports that too much vitamin C or high doses of vitamin C are unlikely to be harmful. And what we do know, though, is that if someone is having high doses of vitamin C, they're likely to then get those sort of gastrointestinal symptoms. So, we know they can get to that bowel tolerance. So just for example, I mean, I don't generally recommend high doses to my patients, but again, I'm talking to practitioners here. In March, after getting back from New York, we were concerned about COVID. My husband was quite sick, had a lot of symptoms similar to COVID, and I was taking 6,000 milligrams of liposomal C daily for about 2 weeks just to really support my immune system there. And speaking about liposomal, one of the biggest questions I get as soon as I bring up vitamin C is what form of vitamin C? And I have found this paper that actually compares oral. So when I say oral, I'm talking about standard oral. So here we're thinking about, powders or tablets compared to liposomal or IV. So going in and getting IV vitamin C. So what we can see here is in this study is that the people had 4 grams, so 4,000 milligrams. So that was 4,000 milligrams, whether they were just having the normal oral, the liposomal or IV, and they compared the plasma vitamin C over time. So if we look over here on the right at the top, I've got this diagram, we can see this graph here. So on the vertical axis, we've got plasma vitamin C. So these are the vitamin C levels. And then on the bottom, we've got time, looking at hours from 0 to 4 hours. What you can see with the IV vitamin C is that it increases the vitamin C levels in the blood very quickly. So that top line, that dashed line there, that's representing the IV. And then down the bottom, we've got placebo, the oral, and the liposomal. Underneath that, in the graph we're looking at B now, we can actually see the difference between the oral, the liposomal, and the placebo, because what they've done is they've actually magnified this. So if you look at here, the vitamin C levels at the top, we're looking at between 0 to 35 milligrams. So down here, they've sort of magnified in, and we're now looking at 0 to 4 milligrams so that we can really clearly see the difference between the standard oral, the liposomal, and the placebo. And what we can see is we've got the placebo at the bottom. So that is those black circles, the black line, and we would expect the placebo to stay the same. They're not getting any vitamin C. So we've got the placebo, then we have the standard oral. So this is what most people take. We're just taking a vitamin C tablet or perhaps the powder. We can see there is definitely a significant increase in vitamin C levels. And then on top of that, with the black dash line and the triangles, we can see the liposomal. So it says encapsulated. This is encapsulated with the liposomes. So you can see that the liposomal vitamin C does actually increase vitamin C levels a little higher. It's not a huge difference, but it's definitely a significant difference. Going back to the notes just here, we can see that despite the delivery method, whether it was liposomal, standard oral or IV, all of these were well tolerated. So this was the 4 grams or 4,000 milligrams. There were no adverse reactions. The IV produced the highest levels, then liposomal, then the standard oral, which we've just gone through. And interestingly, all of them reduced oxidative stress, and there was no difference in oxidative stress markers. And just to note, there are some medications that can lower vitamin C, including aspirin and corticosteroids, particularly if you're thinking about patients with immune issues or in pain, they might be taking these medications, and we need to consider patients that have hemochromatosis. Okay, zinc. So zinc is the other really important one, and no doubt everyone is hearing so much about zinc at the moment. We do know that it can stop the replication of RNA viruses, but aside from doing that, it's also important for both our innate and adaptive immune response. In addition, zinc can actually displace heavy metals. So if your patient is high in heavy metals like mercury or arsenic, you can use zinc to help displace that and reduce that heavy metal burden. It helps support oxidative stress, so it can reduce oxidative stress levels, which increase inflammation. And it also has been shown to decrease a number of immune markers and cytokines. Here we can see tumor necrosis factor alpha and interleukin-1. From a dosage standpoint, generally a daily standard dose would be around 15 milligrams, really somewhere between 15 to 30 depending on your patient. In the case of, again, short-term immune support, so I'm not thinking about long-term autoimmune health here, I'm thinking about if you're concerned about a virus or something like that, you may want to think about having higher dose zinc for a short term, for a few weeks or a month or so, if you are living with someone who's got an infection or something like that, to help protect you. But generally, these standard doses from 15 to 30 milligrams is adequate, and you wouldn't want to be having those high doses long term, because again, zinc can build up in the body, and you also need to think about that balance with copper. There's some evidence that zinc picolinate may be better absorbed. Again, like I get asked about the different forms of vitamin C, I also get asked about the different forms of zinc. I do like zinc picolinate because I find that patients, I work with a lot of very sensitive patients, sensitive to certain foods, sensitive to supplements. They tend to tolerate the zinc picolinate a little better. So here's a great review looking at zinc status and autoimmunity. Again, if I just jump down to the bottom, we can see here that patients who had zinc deficiency were more likely to have autoimmune disease. So some more good reading for you if you are interested. So I've mentioned zinc, and zinc is so important for the immune system, for helping support our antioxidant system, but we need to remember that there are lots of other minerals that are required in the body, and often our patients are low in things like magnesium, selenium and iodine. Again, if we're thinking about our patients with hypothyroidism or Hashimoto's, and I say this because it is so common and I see so many women with Hashimoto's or hypothyroidism, and we know that zinc, selenium and iodine are so important for thyroid function. Even those with Graves', even myself, I don't have iodine, but definitely, zinc and selenium are important, and in selenium can actually help reduce those thyroid antibodies. So magnesium is something I like to use frequently. I like to give it at night to help my patients relax and sleep. And then manganese is also a really other important mineral that actually acts as a cofactor for superoxide dismutase, which is an essential or an endogenous antioxidant that's really important for reducing oxidative stress. So really getting to here is that yes, zinc is so important, but it's not the only mineral, and you may want to consider a multi-mineral supplement for your patients. And also, again, thinking about your patient, their diet, their lifestyle, what other conditions they're having, what medications they're on. Some things can affect the absorption or even the excretion of our minerals. So discussing that with our patients, letting them know that they shouldn't have calcium with certain minerals, not to have their supplements with coffee. A lot of people are actually taking their supplements with coffee in the morning, and that can affect the absorption. So really educating our patients about the right time and when to have our supplements and whether they should be taken with food or without, and generally not with coffee. Another one that is so important, I think in Asia, most of you, I know when I've come over to Asia, you definitely tend to eat a lot more seafood. So perhaps this is not such a big issue for you, but here in Australia and a lot of other countries, people do not eat enough oily fish, and some people don't eat any seafood at all. And that can obviously affect that omega-6 to omega-3 balance. And that can increase sort of pro-inflammatory eicosanoids, causing chronic inflammation. So the omega-3s are really important for dampening that immune response and reducing our risk of chronic inflammation. When it comes to dosages, it's really hard to give an exact dose here. And that's because when you look through the research, you find that there really is a wide variety. So here what I've got is that you sort of really recommended somewhere between 1.5 to 5 grams of EPA and DHA per day with meals. And I've got the reference there if you want to go through that. But it really depends on what your patient is dealing with. So I've given an example here. We've got a double randomized controlled trial showing that omega-3s improved cognitive function for those that had mild cognitive impairment. So those that have mild cognitive decline, perhaps they've got an early diagnosis of dementia or Alzheimer's or having memory problems. We know that omega-3s can help with that, because inflammation in the brain affects our capacity to think, to learn, our memory. So it's really important for brain health as well. And I think I said earlier that some people are suggesting that diseases like Alzheimer's and dementia may be or are similar to an autoimmune disease. Thinking about arthritis, in Australia, the Arthritis Foundation recommends 2.7 grams of omega-3s for joint inflammation and rheumatoid arthritis. So omega-3s, you can see there are so many things we can do to help protect ourselves from autoimmune disease. Here we've got another great review that goes through this in detail, really suggesting, again, if I just read the bottom, I won't go through the whole, I'd like to read the whole abstract. It's great information, but you can do that in your own time if you're interested. But if I just sort of jump down to the bottom, we can see that many of the placebo-controlled trials of fish oil in chronic inflammatory disease reveal significant benefit, including decreased disease activity and lowered use of anti-inflammatory drugs. So continuing on with that, the reduction in anti-inflammatory drugs. So many people are on numerous medications that come with a lot of side effects. And I really wanted to highlight this study because what it showed was that patients that had cervical and lumbar disc disease, so basically they've got inflammation and pain, that were prescribed prescription non-steroidal anti-inflammatories for the pain and inflammation, were given fish oil supplements as a natural anti-inflammatory. So in this study, the people took the fish oil supplements for an average of 75 days. 78% of them were taking 1,200 milligrams, and just over 20%, so the other 22% were taking 2,400 milligrams of those essential fatty acids, so the omega-3s. Within the group, 59% discontinued taking their prescription non-steroidal anti-inflammatories for pain. And this is because they actually stated their overall pain and joint pain had improved. 80% stated they were satisfied with their improvement. Almost 90%, so nearly all of them, said they would stay on the fish oil, and there were no significant side effects reported. So this is huge. So many people are taking these anti-inflammatories, these things to reduce inflammation, and what they could be taking is these natural alternatives. But there is a but. We know when we're working in the sort of world of nutritional medicine and functional medicine that, taking omega-3s is not a quick fix. Having a fish oil supplement is not going to take your pain away immediately. Note here they've said 75 days. So I definitely say to my patients, it may take 3 months to feel the effects, but I think we all know as practitioners, it generally is a lot quicker than that. So in some cases, people report feeling better in a few weeks, but it can take a month or two. But I often say 3 months just so that we're not overpromising. All right, I know we're getting to time, so I will move on. We are getting there. Another really important one to mention is curcumin. In the interest of time, I'll sort of skip over this. I think particularly you all in Asia would know how important curcumin is, and hopefully cooking with it as well. So curcumin, like fish oil, can be used as a replacement for non-steroidal anti-inflammatories. There is fantastic evidence that curcumin can dampen and suppress that immune response. Again, when we're looking at dosage, a bit like the fish oil, it's variable and it really depends on the form of curcumin you're getting, and you need to look at the supplement you are getting, because absorption is a big issue with curcumin. So you need a high quality supplement that is known to be absorbed well. And I personally like the Mariva, excuse me. So curcumin here with autoimmune and rheumatic disease. I also just wanted to mention quercetin. This is something that I personally like. I use quercetin. I've been giving it a lot over the last sort of 12 to 24 months. And a standard dose is 500 milligrams. That's generally enough. If I notice any signs or symptoms, I'll take 1 tablet, and that is and it works quickly. So unlike our fish oils and our curcumin, where they take a bit of time to build up, you can have quercetin and, you know, that night I will go to bed and I won't be having all of those issues with hay fever. For immune support, you might be thinking of doubling the dose. Some recommendations are actually much higher, even about 1,500 milligrams, and studies have shown that you can take really a little bit higher than that, but in my case 500 milligrams is what I take and what I recommend to most of my patients. And there is so much that I could say about herbs. This is definitely not listing all of them, but some of the big players that can help support the immune system: ginger, berberine, medicinal mushrooms, echinacea, black elder, as well as andrographis. And I'll also just like to say, I don't give all of these things to my patients. That would obviously be too much, but finding a formulation, a supplement that has a number of these things can really help balance the immune system. All right, we're almost there. I just need to mention gut health. So we've talked about these big players with the immune system, the A, C, D, and zinc, as well as minerals, some omegas, some herbs, but we definitely need to factor in our patient's gut health. So removing any triggers, you know, are they reacting to gluten? Their gut isn't going to heal if they're having these inflammatory foods. But we can also consider things like prebiotics to help feed the good bacteria, and then also probiotics. But just know that probiotics don't work for everyone. And in some cases, you may just want to think about diet and prebiotics. In other cases, diet, prebiotics, and probiotics is a wonderful combination to really get that gut health back in order. The liver is also important. I've mentioned that chemicals and toxins are a risk factor, high levels for autoimmune disease. So we need the liver to help us get rid of and clear these things from the body. Things that I often give are NAC or glutathione. I generally use NAC. I like NAC because I do a lot with fertility. I like NAC because there are a lot of studies looking at NAC. It's safe in children, it's safe in pregnant women. But really the purpose of giving this is obviously to help support glutathione. And I do know that some practitioners absolutely love glutathione, particularly liposomal, liposomal glutathione. You can also think about things that are NRF2 up regulators. What that means is things that actually turn on NRF2 turn on our endogenous antioxidant system. This is a really, really powerful system that helps combat oxidative stress. So things that stimulate our endogenous antioxidant system include broccoli sprout, so thinking about sulforaphane, milk thistle, alpha lipoic acid, as well as some of the amino acids. Finally, we are almost there, I promise. What I want to finish on is adrenal support. So I know that I've given you a lot of information, but it's really important that we're thinking about all of these factors when we do want someone to recover from an autoimmune disease. Every autoimmune patient that comes to me is chronically tired, is likely to have something going on with their adrenals. People that have autoimmune diseases are often ones that have been pushing themselves quite hard. And we know that if they've got adrenal fatigue, that can then sort of suppress the immune system as well. So you may want to think about adaptogens. Vitamin C is also important for adrenal health. I didn't mention that when we talked about vitamin C earlier. B vitamins and magnesium. And as I said, I definitely give a lot of magnesium to my patients. So in summary, immune dysregulation and autoimmune diseases are common. I think all of you listening would know someone who has an autoimmune disease. Sadly, they are becoming more and more common. To reverse the symptoms, a holistic approach is necessary. We really need to think about the whole person. And we need to help give them a little clarity, answer the why. Why did they develop this autoimmune disease? And to do that, we need to identify the triggers, really starting from the genetic susceptibility, what they've inherited, to things that they've experienced in their life that have ultimately led them to becoming unwell. And then help them accept that they have this particular disorder or this particular disease. And then you need to come up with a strategy. How are you going to help your patient? I've given you so much information. You're obviously not going to bombard your patients with all of those supplements. We need to be thinking about the lifestyle stuff, so the diet and the sleep, they're non-negotiables. If your patient wants to recover from an autoimmune disease, and they can do that by fixing up a lot of these lifestyle things, reducing stress, improving sleep, improving their diet, and then topping them up with whatever supplements and nutrients you think are the priority as the practitioner. Do you need to start with vitamin D? Are they not out in the sun? Are they chronically tired? Do you need to sort of work on the adrenals, or is it all about gut for them? And it's not a quick fix. These are things that you will implement and tweak and change throughout that process. So the patient has to take action. This is not for everyone. Some people will be diagnosed with an autoimmune disease and they will choose to take the medication. Others want to know why and want to get well, because what I know firsthand from having an autoimmune disease and working with so many patients with autoimmune disease is even when they are given a medication, that may suppress some of the symptoms, but they don't feel good. They still don't feel well. They're still tired. They're still struggling with weight. They've still got pain. They might still be struggling to walk or whatever it may be. So by addressing these underlying factors, they're actually truly getting well. But the patient has to do the work. So this is the action part. So that's changing their lifestyle and then actually taking their supplements. If they don't take their supplements, they're not going to work. And then finally, I think what's important to note, and often a step that's forgotten and can really impact on our patients not really reversing their autoimmune disease, is accountability. They need to take responsibility for their actions. They need to take care of themselves, basically. And then you as the practitioner need to be able to provide support and monitor their symptoms. So whether that be adjusting supplements, or talking to them about diet. So really what we want to do is provide our patients with a roadmap back to health. And it really starts with looking at these triggers. So we're looking at their history and then start mapping out what you're going to do. And this is not a quick fix, but it's something that I've personally recovered. I've had so many patients now reverse their symptoms of autoimmunity. I'm cautious with the word cure. I don't say that I've cured my autoimmune disease, despite my endocrinologist telling me that I had it for life, despite most of my patients thinking they have these diseases for life. It's really not about a cure, because you can relapse if you don't take care of yourself. But by doing all of these things, like I've said in the title, really what you're doing is setting yourself up for lifelong health. It's not just about reversing your symptoms of autoimmune disease. It's about enjoying your day-to-day life and then having a healthy life as you age. So on that note, I will say thank you so much for listening, and we have a live Q&A coming up now. So just before I hand it over to Jessie, if there are any questions, I have been sent a few questions here. I just want to mention, if you would like to connect with me, you can connect with me on my business page. So I've got the link there, Facebook, Dr. Denise Furness. You can also join my group. I have a group I started a few months ago, Your Genes and Nutrition Community. So that's my business name, Your Genes and Nutrition, or my clinic name. So this is something that I've started recently, and it's got about 180 patients and practitioners, and you can jump in and ask questions and support each other. Or if you do have any questions, you can email me directly, or obviously contact Pure Encapsulations, or your distributors in the Philippines or Hong Kong. So I'll hand it over to Jessie.
Thank you so much, Dr. Furness. That was very informative. So I don't see any questions, but our time is up. thank you everybody so much for taking the time to attend our webinar this evening. If we didn't get to your question, and if you do have a question, we will make sure to pass it on to Dr. Furness and get an answer back to you. All right, well, I hope that everybody has a wonderful evening. Thank you.